Welcome back to everyone in the room and all of our viewers online. I have the pleasure of doing our case study, which is the fun part. I see that everyone's loved doing all these activities, so this is really going to be the fun part of the training where you take everything that you've learned over the last couple of days and apply it to an actual case study. So we're asking that everyone work in groups at your table to code the select OASIS C2 items for Mr. W, who is our wonderful Mr. W for our case study today, for both the start of care and resumption of care discharge assessments. I did want to mention, just to our online viewers, that the case study, you should have downloaded the case study, and those at your tables as well. You should have the start of care, resumption of care assessment tool and the discharge assessment tool that you're going to be completing. So you should have 3 documents to work through the case study itself, the actual assessment form, and then the discharge assessment form. So for the start of care and resumption of care assessment, we're going to be looking at the OASIS C2 items that we've reviewed over the last couple of days. We're going to be doing M1028, the Diagnoses code, M1060, height and weight, M1311, which was our favorite, with current number of unhealed pressure ulcers at each stage, M1620, the bowel incontinence, GG0170C, lying to sitting on the side of the bed, M2001, drug regimen review, and M2003, the medication follow-up. For the discharge assessment, we'll be reviewing and scoring for Mr. W, M1311, which is the current number of unhealed pressure ulcers at each stage, M1313, which is worsening in pressure ulcer status in start of care and resumption of care, M1620, bowel incontinence, and M2005, the medication intervention. So as I mentioned, you'll be using the following documents in your folder: the Home Health QRP training case study, and the OASIS C2 case study coding sheets, and that again would be for the ROC assessment and for the discharge assessment. We're again just putting out that reminder that the term code and coding is synonymous with scoring, so there's no confusion there. So we're going to reconvene at 11:40, so there's about 25 minutes for you to work together at your tables. Myself, Ann Spinard, and Kathy Roby will be circulating in the room to offer some assistance if you get stuck on any items. Please have fun with this and use everything that you've learned. Feel free to look back at your materials. And again, we'll reconvene at 11:40. Thank you so much. So I think we are going to get started. Would ask everyone in the room with your table if you could try to come to a consensus. We will be using the polling devices, so you can select what you feel is the appropriate answer. Just to level set briefly, we're talking about Mr. W. He's a 66-year-old gentleman who lives independently with his wife. Emergently, he was treated at a local acute care hospital following a fall. He was discharged from the acute care with the following diagnoses: an epidural abscess, MSSA bacteremia, hepatic encephalopathy, alcohol withdrawal, hypertension, lower extremity weakness, and neuropathy. So the home care agency received a referral for nursing, physical and occupational therapies, and home health aid services for Mr. W. He was returning home following a 4-week acute care hospital stay. So we're first going to be scoring the ROC assessment. And the first score and measure we're going to be doing is M1028, active diagnoses. So for this item, you'll be choosing, for Mr. W, you would choose A to check 1, that he had peripheral vascular disease and PAD. You would choose B for 2, diabetes mellitus. You would choose C to check both 1 and 2. And you would check D to enter a dash. So it looks like we have 96%. That's awesome. It seems everyone was pretty clear on how to score Mr. W for diabetes. This is an active diagnosis as noted on his hospital discharge summary and confirmed by the physician, and there's ongoing medication and dietary management. So the next item we'll be doing is M1060, height and weight. So for this item, you choose A for 68 inches for height, enter B for 69 inches, C for 70, and D to enter a dash. Looks like everyone's done. And 97% got this correct. The correct answer was C, entering 70 inches. As we know, his height on the case study was reported as 69.5 inches, so we rounded up to 70 inches. For the second part of this, how would you respond to M1060B for Mr. W's weight? Again, A would be a dash, B would be for 219 pounds, C for 220 pounds, and D for 221 pounds. It looks like everyone's done. Great. So the correct answer was 220 pounds. Again, the weight for Mr. W was reported as 220.3. Because that was below the 0.4 mark, you would round down to 220 pounds. So great job. And the rationale here, as we just described, the patient's height was measured to the nearest whole inch, and mathematical rounding was used for documenting both the height and the weight. So the next item is M1311, the current number of unhealed pressure ulcers at each stage. And we will not be doing the polling for this. We will be doing just a show of hands, so please raise your hands as we go through this. So for the first question, as we know, M1311 has six sections for the ROC. A1 and F1, A1 through F1 need to be addressed, and we do not address A2 through F2 on the start of care ROC assessment. So for Mr. W, how did your group score a code A1 for stage 2 pressure ulcers? Great. Wow, that was unanimous. So yes, the score for item A1 for M1311 was 1, correct. And that is because the admission skin assessment completed by the nurse revealed that Mr. W had a 2 centimeter by 1 centimeter by 0.1 millimeter reddened area over his coccyx, with a 0.5 centimeter serum-filled blister in the center of the reddened area. So how did your group score B1 for stage 3 pressure ulcers? Excellent, that was 0. And for stage 4? 0. A little easier than the scenarios that Ann Smenard did the other day, right? And how did your group score D1, the unstageable, non-removable dressing? Correct. And E1, unstageable slough and eschar? Correct. And how about the unstageable due to deep tissue injury? Great. You're all ready to go. Again, we don't score, as you all know, the A2 through F2 on the start of care, resumption of care, and we'll be reviewing these when we go through the discharge assessment. And this was the rationale that we just described, so that was why we did assess Mr. W as having a stage 2 pressure ulcer. So the next item that we'll be doing is M1620, bowel incontinence, and we're going to go back to our polling questions. So it looks like everyone got that right, like immediately, which is pretty awesome. The polling question, as you can see, you're trying to decide which response for bowel incontinence. And the correct answer, we got 100%, was B, to enter response 2, that Mr. W had 1 to 3 times weekly incontinence. The rationale was due to the recent hospitalization and medical problems. Mr. W is deconditioned and has difficulty reaching the bathroom in time. These incontinent episodes have occurred 2 times over the last week. So the next item is GG0170C, lying to sitting on the side of the bed. Again, we have a polling question. And it looks like everyone's completed the answers. So we have 90% with the correct answer. And the correct answer was C, which is code 2, substantial maximal assistance. And the rationale for this was that Mr. W's wife, as described in the case study, performed more than half. That was that key differentiator. She performed more than half of the effort required to complete the activity, from lying to sitting on the side of the bed, and she supports his trunk and lifts his legs over the edge of the bed to assist him to a sitting position. So great job on that. So the next question is, how would you score the discharge goal for Mr. W? For GG0170C2, we have another polling question. And it looks like everyone's done. It's great. We have 94% got the answer correct. The correct answer was A, code 6, independent. And that was, again, as described in the case study. The nurse expects Mr. W to perform the activity of lying to sitting on the side of the bed independently by discharge. That was in discussion with the patient and his wife. So how did we all do with M2001, the drug regimen review? Again, this is another polling question. And it looks like everyone's done. And we have 93% that got the answer correct. The correct answer was B for response 1, that yes, issues were found during the medication or drug review. And the rationale why it was coded as 1, yes, that issues were found, was because Mr. W's list of medications from the acute care discharge instructions did not match the medications that the patient showed the clinician. As we recall, the metoprolol was in the home, but not on the discharge orders, and the patient stated that he took the medication twice a day. The assessing clinician considered this was a potentially clinically significant medication issue. So that's why we scored 1 for this item. And the last item on the ROC assessment is M2003. That would be the medication follow-up. M2003 asks if the agency contacted a physician or physician designee by midnight of the next calendar day and completed the prescribed recommended actions in response to the identified potential clinically significant medication issues. So we have another polling question for M2003. Okay, it looks like everyone's done. So great, we have 97% got this one correct. The correct response was B, which is response 1, yes. And this is because M2001 was 1 yes for clinically significant medication issue. We needed to answer and not skip M2003 medication follow-up. And the rationale for this was that the nurse telephoned the physician to discuss and resolve the identified medication issues on the same day that they were identified. The physician followed up via fax within 1 calendar day. The nurse initiated these orders the same day she received the fax, and the order for metoprolol was resumed, and the need for metformin was confirmed and continued. So the guidance manual is very clear, as Kathy Roby described on this item, that we need that two-way communication, and the completion of the prescription medication must have occurred by midnight at the latest of the next calendar day. So great job on the ROC. And now we're going to move on to the discharge assessment for the select OASIS C2 items for discharge. So the first item is M1311, and that is the current number of unhealed pressure ulcers at each stage. So again, we're going to be using a sign of putting up your hands, please, as we go through these. So how did your group score A1 on your discharge assessment? Okay, so I heard 0, and that is the correct response. Great job. And how about A2 on discharge? Yep, great job. So now we're moving on to how you scored for B1. I heard a 1, I heard a 0. What do we think? Great job, yep, it is 0. And the number of stage 3 pressure ulcers that were present for B2 would be skip. How about for C1 and C2? That's correct, 0 and skip. Now we're on D1 for unstageable, non-removable dressing. And for D2? 0 and skip. It's like a song, right? We could go into a song for that. 0 and skip. And how about E1? That would be 1, correct. And for E2? 0. And how about for F1 and F2? 0 and skip. Excellent. Great job. Again, that was a little easier than Ann Spinard's scenarios yesterday, but great job. And again, the rationale for this is that upon discharge, the pressure ulcer on the coccyx was unstageable due to coverage of the wound bed by slough, and this was not present at the ROC assessment. So the next item we'll be doing is M1313. This is the worsening in pressure ulcer status since the ROC. So for this measurement, we have the 6 coding options. So for A, what would stage 2 be? I'm hearing 0 and I'm hearing 1. Okay, the correct answer is 0. There are no stage 2 pressure ulcers present at discharge, and that is the question, so the answer would be 0. And how did your group score B for stage 3? 0. Great job. And for stage 4? Correct. And how about for D, for the unstageable, non-removable dressing? 0. Correct. And for unstageable slough or eschar? 1. Correct. That would be scored as 1. And how about for F, the unstageable deep tissue injury? Correct. That would be 0. Great job. And again, the rationale for that is that upon discharge, the patient was assessed to have an unstageable pressure ulcer due to slough that was new or worsened since the ROC assessment. And the patient did have a stage 2 at ROC, and the wound deteriorated to an unstageable at discharge. So the next item is M1620, bowel incontinence, and we're going back to the polling questions. So would you respond to M1620 for bowel incontinence? You choose A for 0, B for 1, C for response 2, 1 to 3 times weekly, and D for NA. And this is a polling. It looks like we're almost done. Okay. Great, so we have 94% with the correct answer, and that answer would be A. The response would be 0, very rarely, or never. And the reason that response 0 is correct is that upon discharge, Mr. W was continent of bowel and independent in toileting. And last but not least, our last polling question is for M 2005, medication intervention. So if you could use your polling device, you'd enter A for a response of 0. You'd enter B for a response of 1, yes. Enter C for a response 9 for not applicable, and enter D for a dash. Okay, it looks like everyone's done. Okay, for this one, we have 71% correct. The correct answer was 1, yes. And this is asking, did the agency contact and complete physician and/or physician designee prescribed medication actions by midnight of the next calendar day? Each time, and that's the critical piece, each time the potentially clinically significant medication issue was identified since the ROC. So the response was 1 or yes for that question, because there was one clinically significant medication issue that was identified by the nurse regarding the metoprolol. It was resolved in a timely manner using that required two-way communication. So there were no additional medication issues identified during the episode of care. So the correct response was 1, yes. So that's the case study. I'm not sure if there were any questions. We had great responses. It seemed there was a lot of consensus on the right answers, which is a good sign. We should be on the questions slide. I'll just click through to that. Were there any questions that I can answer? If there are, please come up to the microphones. So I'm standing between you and lunch. I recognize that. So you all did a great job. We really thank you for your participation. It was great to see everyone working together, and I hope everyone online had a fun time with the case study. I see Mark coming up, so I'm going to let him close here, and thank you again.